High alert has been sounded in North Kerala after an 11-year-old boy died and 20 suspected cases of Shigella bacterial infection were reported in Kozhikode on Saturday. Informing this, medical officer Dr Jayashree said the death took place 2 days back and later 20 people with symptoms, mild diarrhea and fever have been admitted in various hospitals. Most of the infected were people who came into direct contact with the disease. State Health Minister K K Shailaja said the health department will conduct a health camp in the area in a couple of days and efforts are on to locate the main source of the infection. She said health experts have said the infection spreads through water and food and keeping good hygiene was the first thing to be done to arrest the spread of the disease. Worried health authorities have chlorinated all water bodies in the area on Friday. Last year, over 40 children of the West Lower Primary School at Keezhppayyur were hospitalised after they complained of vomiting and diarrhea. The presence of Shigella bacteria was confirmed in the stool samples of at least 2 of the students, who recovered later. Later, the district health department traced the presence of the bacteria from the water body in the siblings' house. According to health experts, shigellosis is an infectious disease caused by the Shigella bacteria, which triggers stomach pain, stomach cramps, diarrhea and fever in those who are infected. Though a worldwide problem, Shigella is more often seen in developing countries, especially in crowded locations such as schools, daycare centers, nursing homes, or regions with poor sanitation. In some cases, people infected with Shigella bacteria do not have symptoms but are still contagious. Besides water, there is a possibility that the bacteria spreads through contaminated food, though the chances of the infection are less in this case, said officials. The health department has directed the community medicine department to investigate each case once again and submit a report at the earliest. Health experts said the infection is not that deadly, but if it is ignored, it will worsen health condition and patient may die of dehydration and exhaustion. It is already been diagnosed. It is not a serious threat. We have to maintain personal hygiene, said Dr. C. Anup Kumar, head of the critical care unit in Baby Memorial Hospital in Kozhikode. Now, here is some additional information on the disease. Though the bacteria is Shigella, the infection is known as shigellosis. Treatment is generally done through antibiotics, which can shorten the duration of the illness. Shigella bacteria spread from one person to another person through various means, even after the infected person is cured of diarrhea. It takes a small number of bacteria to make someone ill. The presence of the bacteria is generally confirmed through a stool test. This infection can be prevented by maintaining proper hygiene. Washing hands properly is known to ward off the bacteria. The bacteria spread not only through surfaces, touching an infected surface and then touching the mouth, but also from eating food prepared by someone carrying the infection. Though people of all ages can get infected, children are more susceptible to the infection. People who are traveling are also vulnerable to the infection as they may get exposed to contaminated water during traveling. Sexual contact with those infected can also cause the disease. News Desk, Kaumudy, English.